The government's move to regulate liquid or gel products containing nicotine will ensure it has total control and prevent illicit trade in such products, said former Customs Department Director General T. Subramaniam. The government has imposed an excise tax at the rate of 40 cents per milliliter on electronic cigarettes, liquid or gel containing nicotine, with effect from April 1st, with 50% of the excise revenue to be channeled to the Health Ministry. Subramaniam said it is better to regulate and control these products so that the enforcement agencies can have total control over all aspects of its trade, thus preventing the mushrooming of illicit trade in it. He said the requirement for local manufacturers of nicotine liquids or gel products to register their activities with the Customs Department would also give the department the jurisdiction to monitor any illicit importers and manufacturers. Economist Carmelo Ferlito of the Center for Market Education welcomed the move to regulate liquid or gel products containing nicotine by taxing them. He said a good harm reduction strategy should be centered on the idea of preserving pleasure consumption and at the same time minimizing or eliminating health repercussions. Ferlito said the legal framework surrounding harm reduction needed to outline preferential fiscal treatment to encourage consumers to move away from traditional nicotine products.
I agree with this article. Implementing an e-cigarette tax to support healthcare workers' pay is a commendable strategy. The rationale behind this proposal rests on the dual benefits it offers.
Firstly, increasing tax on e-cigarette can serve as a deterrent, potentially reducing their use and addressing public health concerns associated with vaping.
This approach not only aims to improve public health outcomes by curbing e-cigarettes consumption, but also addresses the long-standing issue of fair compensation for healthcare professionals, thus enhancing their morale and retention in their healthcare system.
E-cigarette or electronic cigarette have become increasingly popular as an alternative to traditional smoking, prompting various governments to introduce tax on this product. Utilizing the revenue generated from e-cigarette tax to support healthcare workers' pay is a strategic move that can address critical gaps in the healthcare system. This approach not only ensures a steady flow of funds to compensate essential healthcare personnel, but also align with public health objectives by potentially discouraging e-cigarette use through taxation.
The government may impose a tax on vape products as a measure to increase national revenue. Deputy Finance Minister Stephen Sim Chi Keong said the Health Ministry is looking into the legal framework for taxation and there may be an announcement in Budget 2023.
The previous government announced plans under Budget 2022 to expand tax collection to vape liquids containing nicotine by imposing excise taxes at 1,020 cents per milliliter.
I thought it was just a bit of fun, but not being able to breathe because of lung damage is definitely not fun.
It's proven that vapes cause real harm. Every vape is a hit to your health.
One significant issue in using e-cigarette tax revenue to support healthcare worker pay is the potential volatility of e-cigarette tax revenue. As public health campaign and regulation around e-cigarette use become more effective, the consumption of this product may decrease, leading to a reduction in tax revenue over time. This could result in unstable funding source for healthcare worker pay, making it difficult to maintain consistent financial support.
Dependence on such a fluctuating revenue stream might lead to budget shortfalls and compromise the ability to sustain long-term improvements in healthcare workers' compensation and conditions. Thus, while e-cigarette tax could provide an initial boost in funding, their long-term reliability remains questionable.
In recent years, from just $50 million in 2005 to over $20 billion in 2019.
What is dissatisfaction? When someone treats someone harshly or unfairly, it can lead to feelings of frustration and anger as well as dissatisfaction. When healthcare workers receive insufficient compensation, it leads to their discontent. The wages of healthcare professionals who are underpaid and unworthy of the work they do are referred to as inadequate pay. For instance, a discussion of contract doctors in this newspaper revealed that although having the same duties and workload as a full-time doctor, they were only paid 200 ringgit for working 28 hours, while their base pay is only 2,000 ringgit. According to the Court Blue survey, 288 respondents verbatim expressed their dissatisfaction with public healthcare facilities' excessive workload, understaffing, and unequal compensation. Other than that, a lack of resources at work is the cause of employee dissatisfaction. A shortage of supplies and support, including medicine, ICU beds, and other healthcare equipment, can make it difficult for healthcare workers to perform their duties in public healthcare facilities. What is unfair treatment at work? Unfair treatment or workplace bullying occurs when some employees receive different treatment from their peers for reasons unrelated to job performance. It could lead to increased levels of stress, anxiety, and shame. Moreover, this will cause healthcare professionals to leave to pursue other employment opportunities. This is supported by a Court Blue survey that found that 1,205 respondents, or 73% of the 1,652 government healthcare employees surveyed, were thinking about quitting their positions. Furthermore, about 80% of respondents to the Court Blue survey said they felt underpaid and overworked. Due to staffing shortages, contract medical officers must put up with excessive workloads and long hours, which can lead to stress and burnout. The pandemic that struck in 2019 made the healthcare system worse by affecting the mental health of medical professionals. After 2 years of working long hours, surrounded by illness and interacting with challenging patients and families, the healthcare workers are burnt out.
Revising salary for civil servants, including healthcare workers, boosts efficiency and productivity by enhancing job satisfaction, motivation, and financial stability. Adequately compensated workers focus more on patient care, perform better, and are more dedicated. Competitive salaries attract and retain skilled professionals, reducing turnover and ensuring a stable, experienced workforce, which is crucial for maintaining high patient care standards and an efficient healthcare system. Strategically utilizing synthetic revenue and addressing leakage and wasteful spending in healthcare can give an impact towards enhancing public health. A well-managed healthcare system can have a positive impact on public health outcomes, addressing issues such as non-communicable diseases, improving preventing care initiative, and promoting overall well-being within the population. These funds can support initiatives against non-communicable diseases and enhance preventive care, which is leading to better health outcomes. Efficient resource management ensure expanded services, advanced technologies, and health education, promoting overall well-being and a more resilient healthcare system.
Workers in Malaysia have not received a salary review in nearly 10 years. Using e-cigarette tax revenue to review pay and adjust outdated allowances could actually help to ensure fair compensation across all healthcare professions, not only for the doctors. And this could improve worker welfare and reduce burnout.
A survey found that 73% of government healthcare workers were considering leaving their job, citing issues like immense workload, understaffing, unfair payment, and also insufficient amenities. Providing fair compensation from e-cigarette tax revenue could actually help to address these concerns and retain their workers.
So, we move on to the recommendation. The first recommendation is to implement a task force for a better resource management. It has to be done to supervise the distribution and administration of healthcare funds and form a special task force comprising the Public Works Department JKR, Ministry of Health MOH and Ministry of Finance MOF. This task group would be responsible for setting priorities, cutting down on waste and linkage, and making sure that money is used wisely for both structural and operational changes in the healthcare system. A task force like this would encourage openness and responsibility, guarantee that the additional funding allowance yields noticeable enhancements in the provision of healthcare services. The second recommendation is to regularly review and adjust healthcare workers' salaries to ensure they are competitive with market rates and reflective of their skills and responsibilities, and make sure the healthcare workers are fairly compensated for their experience and the critical nature of their work. This can be done through benchmarking against similar roles in other industries and regions. Healthcare organizations must regularly benchmark their salary structures against industry standards and regional cost of living adjustment. This ensures that healthcare workers' salaries remain competitive, attracting and retaining talent in a competitive job market. For instance, comparing salaries with similar roles in other healthcare facilities, both locally and nationally, can provide insights into whether pay rates are competitive. Also, establishing transparent pay scales based on objective criteria such as education, experience, and job responsibilities promotes fairness and equity among healthcare workers. Transparent salary structures reduce the likelihood of subjective bias in compensation decision and provide clarity to employees about how their salaries are determined.
I have worked 75 of the last 77 days. It feels impossible to keep up. What if I get my kids sick or my parents? What if that's me next week?
Imagine a world where our healthcare heroes are not drowning into paperwork and impossible workloads. Imagine if they had the resources they need to truly focus on what matters most and their patients' well-being. This is not just about keeping our staff happy, although that's important too, but it is about preventing situations where burnout leads to frustration and potentially unfair treatment of patients. We all deserve a healthcare system where everyone feels respected and cared for. So when our healthcare workers are supported and empowered, it's going to create a ripple effect. They are not just healthy and happier, they are able to bring their best self to work, leading to a more positive and productive environment for each of us.
In conclusion, using e-cigarette tax revenue to support healthcare workers' pay is a strategic and impactful approach to addressing both public health and workforce issues. Allocating these funds to increase compensation for healthcare workers recognize their critical role, especially in times of crisis like the COVID-19 pandemic, and helps retain and attract skilled professionals in the healthcare sector. Additionally, this policy can prevent e-cigarette use, promoting better public health outcomes. By linking the tax revenue from e-cigarette to healthcare worker pay, governments can ensure a more sustainable and dedicated funding stream for those who provide essential services, ultimately enhancing the overall healthcare system resilience and effectiveness.
It's been a long road. Even as the pandemic turned our lives upside down, you've kept us safe with your steady hands. You continue to show up every single day. You've made countless sacrifices. Long hours, the discomfort, the time away from loved ones. When things seemed impossible, you never gave up.
Bravely leading the way through every moment, touching lives, saving lives, giving hope.
To all our healthcare workers,
we owe you a debt that cannot be repaid.
And we couldn't have gotten here without you.
So thank you for everything.